But what can we expect after that day passes? We're joined live this morning with Dr. Dana Hawkinson with the University of Kansas Health System. Doctor, when that new stay-at-home order is lifted, we've talked about this a little bit when you were on a few minutes ago, but what can we expect once that May 15th deadline comes and goes?
Yeah, this is hard for everybody, family, friends, people who need to be working, our economy. I think after we would like to probably roll out the economy as they have been talking about, open up services if we can, get restaurants and bars and other places of gathering back open. We don't know really what that will look like. We certainly have the time right now after this extension to figure out exactly what to do to, again, keep people safe so that we don't have to have a shutdown again, keep our health system from being overwhelmed. Those are lots of questions that we need to have answered. There's a lot of gray area, but now we have the time to be able to look at our numbers, to see what the timeline of the virus is, and then make those determinations as best we can once we get to that point. But it's certainly going to be complicated, and there's going to be a lot of details in there.
Doctor, a meat food processing plant in our area will close its doors this week after stopping production at a different plant due to a coronavirus outbreak among employees. And we know a small number of employees at this plant in Martin City have tested positive. With jobs in environments like that, massive facilities preparing food, what challenges do workers face when it comes to social distancing?
Yeah, I mean, I think all places of work, you run into the issue of, is there adequate space for social distancing? This has been one of our concerns since day one, is our supply chains. Our supply chains for paper products. Obviously, you've seen a lot of people out buying toilet paper. Our supply chains for soap and hand sanitizer and even food. Are these places that are creating the products we need to buy, and those places where our essential workers are, where they are selling them to us so that we can continue to have as much of a normal life as possible, are those adequate for social distancing? In addition to the social distancing, are those individuals at those places of work, are they taking the precautions of washing their hands as frequently as possible, not touching their face? I don't know the exact details of those workplaces, but those are certainly concerns because we need to keep these plants open. We need to keep our supply chain going. So when these meat processing plants go down, and we've heard about a few of them now, it really does put a dent in our supply chain and our economy and the ability for people to get basic needs.
That's Dr. Dana Hawkinson from KU Medical Center talking to us this morning. Doctor, we appreciate your time as always. Thank you for answering questions. If you have viewer questions that you'd like to send in, let us know so we can ask Dr. Hawkinson the next time he joins us next week. Thank you so much.